So a hydrocele, literally hydro means water and cele means sac. So a hydrocele is a sac of water. And in this particular context, it refers to the sac that surrounds a male testicle, which normally is a potential space. It doesn't usually have fluid in it, but when that's an abnormally a larger collection of fluid, it's more visible and looks asymmetrical compared to the other side. So that is what essentially a hydrocele is, a collection of water around the testicle. And there's three main types, I suppose, that are relevant in a human, but more so in children, is the communicating hydrocele. We have a hydrocele in children where they're born with one, and that's very common. So 3 out of 5 boys can be born with fluid around their testicle, but that usually disappears very soon after birth. So a communicating hydrocele is one where this persists beyond the newborn period and is often more present at the end of the day when gravity, the boy has been upright more, and less so overnight when he's been sleeping in bed. And that's the more common type of non-newborn hydrocele, and that's called a communicating. And then there's a non-communicating hydrocele, which is when the sac itself makes the fluid. And that's more commonly seen beyond childhood. In the canal, in the groin, you can get a cyst of fluid, which is the same kind of mechanism in that it's the same material that the sac around the testicle is made from, and that's called a hydrocele of the cord, and that's often confused with a lump or causes of a lump in the groin. But it tends to be painless, and that's the key with all these swellings in the testicle or the groin. If it's painless, then it's more likely to be a hydrocele in nature. In children, no. Often causes a lot of alarm in parents because they suddenly see this large bulge, and of course it does have to be differentiated from that of a hernia, which is a little bit more urgent to treat, often not as an emergency, but still it needs to be differentiated from that because a hernia does not get better by itself, whereas a hydrocele can. So not treating a hydrocele immediately is fine. A period of observation is often very common, depending on the age at when the patient was referred. Most hydroceles have disappeared, as I say, after the newborn period. And if they haven't really gone by the age of about 18 months to 2 years of age, they're probably not going to go. And it's around that time that we start to see them in the clinics and then plan for possible operation. Some of them still can go, but invariably, they, up to the age of about 2, they still can disappear. Yeah, and it happens. It's very common. It's about 1% of all boys will end up with having a consultation for a hydrocele. We are happy to see parents who are concerned at any time, because sometimes it's reassurance that is most important. So usually after the newborn period, it's often not, it's worthwhile waiting to see after that initial hydrocele has decreased in size. But certainly, later on, post-newborn period, if reassurance is needed, but certainly when you're getting to the ages of about 18 months to 2 years, then I think a consultation is really important, not only to either reassure on the fact that the swelling is decreasing in its trend, because then we also might consider a longer period of waiting. But if it's very large as well, and really if it's very large at any age, I think that's important to come and see a paediatric surgeon, because again, sometimes very, very large hydroceles are quite rare, but they can cause more problems than your average hydrocele. Well, it's a clinical diagnosis. Usually we wouldn't normally get scans. if you go to a specialist pediatric surgeon or pediatric urologist, they're going to be able to make that diagnosis clinically. And clinically, it's important to differentiate, as I said before, between that and hernia. And often at primary care level, that will be possible. But a hydrocele is diagnosed by its painless symptoms, the fact that it can go up and down in size. We use something called a pen torch, which is a bit like this, but has a light on the end of it, and we shine that behind the fluid. And if it lights up brilliantly, then we call that transillumination, and that is a common way of detecting hydrocele. In very young infants, though, that can also, hernia can also show itself with that test. But usually I would say it's not a radiological. We don't need scans to diagnose it because it's a fairly straightforward clinical diagnosis. Yeah. And that's a good question, particularly with a communicating hydrocele. So a hernia, which is where the hole that it joins the groin to the scrotum, which should have closed off at birth, doesn't quite close. And when fluid drips down through that open channel from the abdomen, because we all have fluid in our abdomen around our intestines, when that fluid drips down through that little hole, that's what causes the hydrocele. And eventually, as a patient grows, that hole can get bigger. And so there is always a potential for inguinal hernia, because that is a bigger hole allows for intestine to go through it. But the mechanism and actually the procedure to correct it is exactly the same. In terms of damage to the testicle by not doing it, that's pretty unlikely. If you leave into adulthood, particularly if it's on both sides, then there is the risk that the testicle will have the effect of being warmed, and we think, therefore, that could have effect on the function of the sperm and the formation of sperm. And certainly there is I think about 10% of adult males in infertility clinics have had hydrocele or have hydroceles. But the main reason for doing it, and of course, if it's very large, and certainly in adults, very large hydrocele has risks of being more likely to have it injured, so trauma and bleeding within it. But we rarely see that in children.